we're back to pre-breakout room number. So welcome back, everyone. I hope you have enjoyed your conversation with your small groups. I'm going to ask one by one for our planning committee members to come off mute to ask their question or make their comment to our three presenters. We're going to let every breakout representative go ahead and make those comments or questions. And then at the very end of that, we will ask our three presenters for any reactions, comments, or reflections based on those. We're also asking the planning committee members to go ahead and put their questions in the chat box so we're all able to see those as well. So I'm going to start by turning it over to Kenya.
I had a feeling you were going to go in alphabetical order. So I have my question, but it's rather lengthy, so I didn't get a chance to put it in the chat box. But we had a very rich discourse, and we recognized, we even thought about 9/11, where the police department and the fire department and the FBI, and they did not communicate between systems. And we felt that the same thing happened with this pandemic. We were not communicating between disciplines. And when disciplines don't collaborate, the ripple effect outside of our discipline creates damaging silos. So the question is, when the pandemic fades, what can we do collaboratively to be better prepared for the next crisis? And how do you envision this collaborative?
Thank you, Kenya. We're going to get all the questions first, so I'm going to turn it over to Rena now.
Thank you so much. We also had a wonderful discussion and discourse. Thank you to the panelists for presenting such thought-provoking presentations. Our question was, what are professional organizations and health professions education programs doing now to address hands-on practical clinical skills that were compromised in those students and learners as a result from being pulled in the clinical learning environment?
Thank you, Rena. Mark?
Okay, we had some lively discussions. We actually had a couple of questions. One of them was centered on the fact that pulling students out of our rotations created weaknesses and gaps in their competency. And one of our questions was, how do we identify where those gaps are, and now what do we do to remediate it on the back end of things? So that was one. Another piece that came out of this that's kind of related was, does this crisis create a case for competency-based education that gives us more flexibility in determining learner competence than the more structured and rigid models that we use now that were broken by all the decisions we had to make in this pandemic and created gaps in the first place?
Thank you. Casey?
Thank you so much. We had several different lines of conversation. We had a very robust conversation around competency-based education and how to evaluate competencies in different levels of students that could then easily be translated over to the practice side. But I think one of the most important conversations we had from my perspective, because it really did shed some new light and some new insights for me to think of this in a different way, is that there really is this confluence of an emerging mental health crisis and a potential for early burnout of the new health professions who were entering into the workforce. So the students, they didn't sign up for this, right? None of them came into this world of health professions education, regardless of what discipline, thinking that this is going to be what their experience was, this is what their experience would be. And they're really missing out on the personal connections, the support systems, and the infrastructure. And they've also had their own personal impacts from COVID, professionally, personally. And they also now don't feel like they're really valued members of the health team. And so when we think about this confluence of all of these different factors, I'd really love to hear the panel's reflections on what are your thoughts about this emerging mental health crisis of all health profession students, and how might we help to support them as they make this transition into health professions when we need them now more than ever.
Great, wonderful. Thank you, Casey. Lisa?
Hello, everyone. I'm going to yield the floor to Ms. Pam. She's going to be giving you our question.
Thank you, Lisa. Our group had a dynamic dialogue. And one question that did come up was that now that we've lived through COVID and we did all we could to be flexible and creative to provide that instructional continuity, how are we transitioning our health profession students now to the healthcare sector? What changes are being done in the healthcare organizations to accommodate some of those students who've lived through COVID for 18 months, had a lot of virtual instruction, less patient care encounters, more experiential immersion and simulations or whatever. So what's being done on the other side to prepare for this group of workforce, health professionals? For instance, does orientation look different, longer, better? People reteaching the skills? Are there different assessments with our learners coming in? Longer residency times? What's being done? Is that all being evaluated, and what's working? In addition, we talked a lot about the technologies during the COVID and the prominence of the use of technologies, of course, again, to provide that continued instruction. And then there were some learning, lots of learning. If you hadn't done online courses, had to get on Zoom and learn how to teach online. In addition, I know telehealth was just a game changer in medicine, but then it also raised questions, technology, now new technology competencies, both for educators, professionals, students. But then the other question about the divide, about the equity of the educational experience for those who were in rural or low bandwidth areas and didn't have the technology. So thanks, Lisa. I don't know if I captured all, but that's our highlights.
Thank you, Pam. Thank you, Lisa. And I will now turn it over to Jasmine.
Hi, everyone. Last but not least, the student voice. So our discussion really kind of centered around how can we emphasize the student voice in the conversations that we have. So our questions were, where can health professions include and honor diverse student voices and intersectional identities? Some examples of that would be previous leadership and life experiences outside of their respective programs. And then how do those identities factor into crisis decision-making in the future? And then prior to this inclusion, how can health professions leaders effectively explain the why behind decision-making processes to their learners? Like some of the accreditation decisions and risk and liability, all of those things went into our second question. Thanks, Erin.
Thank you. And thank you to all the groups. These are wonderful questions, and I wish we had more time to reflect on them. But let's go and just go through our three presenters and allow you just a few minutes to respond to any questions or comments you heard. So let's start with you, Keisha.
You know, I took my mute off because I really wanted to go first. Because there's a couple of things that were brought up here, and I believe that it was Pam and Casey, and it was really around the mental health crisis of health professional students, and then also how are we bridging this gap between healthcare professionals that are coming into the workforce. And as I mentioned earlier in my presentation, these 72 nurse residents that we have in our organization that we brought in August, their training was online up until the time they came into the residency program. And they were literally terrified to go into patients' rooms and to even brush up against somebody. So we saw a lot of fear and anxiety. And so we know that, you know, in an already stressed environment, that magnified that. And so what we've done with these 72 residents is that they are in these small cohorts where they have a coach, and that coach is kind of the person that facilitates their learning across the organization. And then they also have their preceptor, and their preceptor is the person that actually helps with them in terms of that's the person that they shadow. And we've tried to maintain that continuous. But what's really great about the preceptor program, there's this whole model called novice to expert. And we've been very intentional with not putting a brand new grad or a new grad with a nurse that's been practicing for 40 years, because they are intimidated. And so what we've done is we've built in that their first rotations are with a nurse that's been practicing for 1 to 3 years. And then it's a nurse that's maybe over 3 to 5 years. And then it's a seasoned nurse. But in addition to that, we've also provided a mentor, and a mentor is just someone that's just there, that's committed. It's another nurse that's just there for them to just vent and unload and share their fears and concerns. And the whole intent there is to really close that power distance that these nurses are also feeling. And because we want them to stay, we know that there is a risk that that we could lose them to the profession altogether. They are so fragile coming into our workforce that we are handling them with kid gloves. And so this 72-person cohort we have is kind of our pilot of that, but we're already seeing that we're going to have to do more with them to be able to preserve that. So I hope that kind of answers that question, both of those.
Thank you, Keisha. Julie, any reflections?
Sure. I mean, there's a lot of great questions. Hard to know which direction to go first, but I think one thing that struck me in several of the questions is just this uneven impact of the pandemic, and in several ways, right? So, our learners are heterogeneous when they come to us, right? Some of them have different life experiences prior to entering the or other professional experiences prior to entering their program, and we tend to loop them into or lump them into the group that they're their first years or their, and we don't have a very good mechanism, I think, of assessing what their experiences were prior to coming into the program and how they might contribute to the issues, the crisis that we're experiencing is one thing. And I think the other piece, obviously, is the differential impact on the students. Many students had family members affected deeply, came from communities that were really heavily impacted by the pandemic. And I don't know also that I think we've all added mental health supports to our training programs in significant ways, and we need to maintain that commitment. But these are the differential impact before in terms of how students arrived, and then during the pandemic certainly impacts their ability to transition to the workforce and their readiness for that. And how do we, I think we have to learn from what we've all experienced and better ways to assess that so that we can meet the learners where they are to achieve the mutual goal that I think we have, which is to get them into the workforce to be the effective members that they want to be and that they should be, but they may have different needs in order to get there. So I think some of that in thinking about decision trees is how do we take that into our decision making for what programs are needed to support them. And I'll say one other thing, because I know we're running out of time, which is somebody mentioned competency-based education, and I do think that what we all experience indicates a leaning more towards competency-based education. In public health, we are very competency-based in our coursework and in our experiences. And I think when you have competency-based education, it allows you a little bit more flexibility to think about how the many ways you can get to that competency. And it gives you the ability to pivot and innovate a bit when circumstances demand that of you. And so I think this is another push towards competency-based education, particularly as we come out of a crisis or while we're in a crisis. And I'll stop there.
Thank you, Julie. Yes, we've heard from some of our planning committee members that the focus on competency-based was very disparate across professions and it had some impacts there. And lastly, Allison, some of your reflections.
Yeah, I would build on the competency-based side of things. It answers a couple of the questions, what do we do about the disrupted education? What do we do about disrupted clinical skills? And then just one other area into that we haven't talked about, but for those practicing health professionals who were redeployed, which was both residents and practicing physicians, as well as some nurses, that competency-based was critical for, what do I need to know to be able to be working in this new work area? So I think it has really created a new needed emphasis on truly developing competency-based education and assessment that is flexible and can be, developed in micro areas as well as sort of globally. And I wanted to comment just on one other comments, the one question that hasn't been addressed at all. Technology, yes, we need to decide what should be in person, what should be by technology. I think that we've learned a lot and we need to just take that forward and use technology as we should and use face-to-face as we should. Quick answer, you should have a whole nother workshop on that. There was the one comment about the student voice. And I think that was the question. And I think what I heard over and over again, as I've talked to students in multiple health professions and leaders at multiple schools, related to both the pandemic and related to the civil unrest related to racism, is that those schools that truly included students in decision-making, included students at the table, and had ongoing bi-directional conversations were most successful in really meeting the students where they were and continuing that. And I think that that needs to be a critical message. It should be something we've always done, but it's absolutely critical in times of crisis. And then the last thing I will say is we're talking about the differences between students. We've been talking about the social determinants of health a lot in healthcare and in health professions education. And another concept that's parallel to that is really the social determinants of education. What are those barriers for entry, progression? And I think that just as social determinants of health impacted pandemic, the pandemic really highlighted the social determinants of education, how we really need to pay attention to that if we're going to have equitable health professions education programs. Thank you.
Thank you. I'm going to turn it over to Bob to finish out our afternoon today. You are on mute.
Thank you for the reminder. All right, well, we may actually have 2 minutes extra as we wrap up here. So I want to take a moment before we end our meeting to thank Erin Patel, my co-chair, the NAS staff, the speakers and facilitators and participants for joining today. It's been a great learning opportunity. And we certainly appreciate the contribution from the panelists. So we'll have the opportunity to take this and continue to shape this journey as we continue the conversation about students in the workforce. So please stay tuned for our next session in this workshop series as we continue exploring aspects of the decision-making process. Thank you and have a great afternoon.